I would like to just mention that the HHAP program is a non-renewable funding streams. However, we are on our 5th round. And as a part of the 5th round's eligible, the responsibilities of organizations that are pursuing HHAP from the state, we have to do a series of community input sessions and create essentially a regional plan in partnership with the County of Monterey, the County of San Benito, and the Coalition of Homeless Services Providers as the Continuum of Care lead agency. Lauren, is there anything that you would like to add to that?
Just kind of putting out that, we really appreciate that the input comes from all aspects and community members within Monterey and San Benito County, whether or not you have previous experience of living homeless, or you are a neighbor, or just work in the field, or an advocate. All of those perspectives are important to us, and we hope that you participate and share your opinions with us.
Thank you. So as we are embarking on the requirements of Assembly Bill 129, we are utilizing a survey to compile all of the data that we're collecting from all of the populations that Lauren had mentioned. So on your screen, you should see 2 QR codes. One is for the English version of the survey, and one is for the Spanish version of the survey. Please use your cell phone device or tablet for you to access those surveys. We also put those inside of the chat for your convenience. As I mentioned, this is a 2-county and a continuum of care partnership. So as such, we would like for you to identify which county you are representing. Both Monterey and San Benito County has a long-standing partnership a history when it comes to homelessness. However, where we are in our interventions is very different, and the population that we're serving is also very different. So we would like to be able to peel out information for each one of the county decision makers, and also put it in one place so the coalition who oversees the region can see in totality what the needs are. So please take a moment on your survey to select either Monterey County or San Benito County. We are now going to enter into the section of the survey where we talked about the effectiveness or efficacy of the eligible activities that the Homeless Housing Assistance and Prevention Program funding can pay for. There are many, and we did our best to explain what each one of these interventions are, or these, eligible activities are, and give you some pros and some cons of each one, so you can take that into consideration as you are rating them on a scale of 1 through 10. On that scale, 1 meaning that you believe that these interventions are not effective at all at reducing or impacting homelessness, and a 10 being very effective. So let's go ahead and move forward on the survey. The first one is rapid rehousing. Rapid rehousing provides services and support to help people quickly find and move into new housing. It usually includes case management, housing search, and short-term rental assistance and move-in assistance. The goals are usually to help people obtain housing quickly, increase self-sufficiency, and also to stay housed. And of course, the pros is it assists with deposits, applications, and moving fees, and it promotes client choice. Oftentimes, clients may not live in an area where there's a lot of homeless services in general, and they want to stay in their local neighborhoods. So rapid rehousing funding really is money. It's not actual units. And therefore, clients can elect to live in any community, even outside of Monterey or San Benito counties, with this funding. The cons are, of course, that there's a low availability of affordable housing units, which can prolong housing search and limit access to housing. Sometimes families do only need assistance with deposits, and they're able to sustain that housing. However, sometimes they need long-term subsidies, which rapid rehousing does not do. In general, in our community, rapid rehousing is a 3 to 6 month intervention. Sometimes you'll see it go 9 to 12 months. But in general, we try to get people quickly housed and stable within 3 to 6 months. So please take your vote now. The next one is operating subsidies. Operating subsidies are funds that service providers need to run service programs, right? So they cover the cost of staff, they cover the operations of the affordable or supportive housing units or emergency shelters and navigation centers. This pays for keeping the lights on. And the pros are it's absolutely essential. We need to have operating subsidies in order for us to keep services going. And investing in operations also supports local nonprofits and local jobs. But the cons are utilizing one-time grant funds to support operations can often leave smaller organizations at risk if they are not able to identify other operating subsidy funds. But regardless, it is absolutely necessary. And you'll find that as we go through all of these different eligible expenses, they're all very, very necessary. And the question just becomes, how do we prioritize this very little bit of money for our community? So please take your vote now. And the next one is street outreach. Street outreach is designed to meet the immediate needs of people experiencing homelessness in unsheltered locations, and it will connect people to emergency shelters, housing, or other critical life-saving services often. And this provides them with urgent, non-facility-based care. This street outreach also covers safe parking programs and helps connect people to services that way. And the pros are clearly it provides case management services beyond the walls of an office. Traditionally, pre-outreach, I was around during that time in our community. People, regardless of where you're experiencing unsheltered homelessness, were asked to come into offices. So imagine if you were experiencing a homelessness in somewhere as far as like King City, and your nearest office for homeless services is in the city of Salinas. So street outreach breaks down those barriers and brings services to people where they are experiencing homelessness. And it is incredibly useful during emergencies or dangerous weather conditions. We can deploy outreach teams to go let people know a storm is coming. This is where the emergency shelters are going to be stood up. Outreach has been phenomenal in assisting us keep that communication going between the system and people who are experiencing unsheltered homelessness. However, the cons of outreach is it's completely labor intensive, and the majority of the funds go strictly to personnel. And then also the services don't really include immediate access to shelter. That's not exactly something that we have set up in this community quite yet, where outreach teams can refer directly into shelters. It is something that we clearly need to work on, but right now, that is not an option. So please take your vote now on your ideas of the efficacy of street outreach. The next one is service coordination, also known as case management. It is essential, vital, really, to providing life stabilizing services, including and not limited to mental health, substance use disorder, jobs, physical health, public benefits, and housing navigation, right? You need those case managers to help get people connected to the services that they need to stabilize. And the pros are it will help address multiple issues that impact a person's ability to be self-sufficient. And it increases the likelihood of the person achieving stability. However, similar to outreach, the vast majority of the funds go towards personnel, and service does not necessarily include housing units. It doesn't create new housing units. It doesn't necessarily, it's not even necessarily tied to housing units. So please take your vote now. The next eligible category is system support. So this is kind of like that intervention that people don't really think about. System support provides funding to system building activities, which includes things like the Homeless Management Information System, coordinated entry, which is locally known as the Coordinated Assessment and Referral System, or CARS, planning, evaluation, policy making, pursuing funding, among all the other things that it takes to create a comprehensive system. The pro, of course, is that it increases collaboration and accountability among service providers and key stakeholders, and it's often a requirement for receiving funding. Plus coordinating plans and collecting data to help identify issues, focus goals, and track progress. All of that is essential for us to know if the system that we have, or that we're working on, that we're designing, that we're repairing, is working. The con is it's not a direct service. So you don't see this funding actually making it to the people who need the services, right? And with limited resources in this community, it really is a balancing act on how do we know that we are evaluating our system and making the right improvements, and those improvements are working. Also, how are we going to keep our service providers funded so that they are doing those services? Please take a moment to vote on system support. So the very next one is the permanent supportive housing and innovative housing solutions. This is kind of like a catch-all, which is essentially the creation of permanent housing units. And that could be anything. It could be traditional housing, like purchasing a house. It could be non-traditional housing, like tiny homes or modular units, or the conversion of motels into supportive housing units like Project Home Key. Monterey County has gotten 3 in Salinas, 1 in King City, and we just heard that the city of Salinas just received another Home Key, so that would be 4. And we know that these conversion of motels are really like a game changer for supportive housing. The pro is it directly invests in creating new housing opportunity, and it increases and diversifies the types of affordable housing that we need in this community, right? Because not one type of housing will fit everybody's needs. The con is it is a long-term strategy that requires significant financial investment and often needs to be paired with ongoing operating subsidies. So when it comes down to permanent supportive housing, when it comes down to developing new housing, it can take years. But we would need to give that money up now to prepare for that, the development of the units. So please take a vote now. The very next one is called interim sheltering, also known as emergency shelter, or sometimes even referred to as transitional housing. Interim shelter is a catch-all phrase that provides temporary places to for people to stay. It addresses the basic needs such as food safety and hygiene, and provides supportive services to find and obtain housing. The pro is that the idea is that it provides immediate relief, shelter, and basic needs while working on improving health and finding housing. But the con is interim shelter is temporary and it is not permanent housing. Actually, there are many emergency shelter overlays, laws in effect that says that people should not be staying in interim shelter for more than X amount of time, depending on how that program is structured. It is a costly service that does not impact the goals of creating new housing, right? Both Monterey County, San Benito County, and also many of the cities in Monterey County have adopted the Lead Me Home 5-year plan to reduce homelessness. And a big chunk of that is us creating over 600 units of permanent housing. So interim sheltering does not contribute to those numbers. Not to mention there's also the regional housing needs assessment and all of those other things that we need to be paying attention to when it comes down to developing affordable housing. And it also does not prevent people from losing housing. At the point in which an interim sheltering comes in, they have already hit homelessness. But we also have waiting lists of all of our interim shelters. There's definitely a need here, and our shelters are definitely doing good work and, really exceeding the expectations of the community when it comes down to housing people, even people who are chronically homeless. Our interim sheltering system is really robust and is doing a fantastic job. So, there's that. It's a lot to take into consideration. The next one is prevention and shelter diversion, which we actually don't have a robust prevention or diversion system in either one of our counties. Prevention and shelter diversion means keeping individuals and families housed by preventing them from becoming homeless or needing shelter. So you're literally diverting them away from the homeless response system. It is meant to help those who are in unstable housing situations, including those who are facing an eviction, living in overcrowded conditions, or are running out of places to stay, like couch surfers. These programs provide financial assistance and robust case management. The pro is it reduces the number of people who are becoming newly homeless, right? It stops or it slows down that inflow. And it aims to intervene and stabilize people before they enter into the shelter system. The longer people experience homelessness, the more resources it takes to pull them out, right? So this is a cost savings effort. The con is it does not actually assist people who are currently experiencing homelessness. So it is one of those situations to where you want to stop that inflow, like we saw during the pandemic when there is moratoriums and there was people who were receiving emergency rental assistance. We've seen how incredibly helpful that was to slowing down the pipeline into homelessness. But there are still people who are living unsheltered right now. So this program or this funding, if we were to use it for this intervention, would not actually assist people experiencing unsheltered homelessness. Please take your vote. We can also use this funding to make improvements to existing shelters, right? So funding for improvements to existing shelters can be used to increase privacy, reduce barriers. Examples of this may include adding more beds or partitions, walls, installing wheelchair ramps. And the pros is it helps with shelter habitability and alignment with current best practices and legal requirements. The law changes, and oftentimes that has these implications. We need to change some sort of infrastructure to one of our buildings, and this type of funding is flexible enough to be able to accommodate that. The cons is it's not permanent housing. So again, we have these other responsibilities of needing to create places for people to go. They can't stay in the shelters forever, right? So this, again, is just balancing out all of the different needs of the community and figuring out how we're going to spend this very limited amount of funding to serve them. Now that we're done with that section of the survey, you will see that we have all of the things that we're currently paying for with the HHAPs. And this, again, there's 2 counties and 1 continuum of care, which is the coalition. And when you just kind of take it what everybody is paying for already, we threw it inside of this part of the survey, and we would like to ask you to prioritize. If you were in charge of this money and you needed to make decisions on how we would spend our funding, how would you prioritize? And this is going to take a little bit of some time, so I'm going to just read through it slowly as you're thinking through your survey. The first one, again, is housing navigation centers, also known as interim sheltering. There's also safe places for people to sleep, also known as safe parking or street outreach. We have mobile service teams, also known as street outreach, programs that move homeless families and individuals into permanent housing through with continued case management, rapid rehousing, rent payment assistance and eviction prevention, that's prevention and shelter diversion, affordable housing units, again, permanent supportive housing, or those what was it called? It was permanent supportive housing, or yeah, that one. Just go with that one. And then also the system support, right? Data analysis and all of that fun stuff that many people don't really think about when it comes down to building a comprehensive system. And then finally, the operational subsidies for a program. Again, those could go for emergency shelters, housing navigation centers, permanent supportive housing projects. But operating subsidies is fairly wide as far as what it can support. Okay, moving forward. Now, this is where it starts to get really good, because this is that open-ended question. What are we not doing? And for the cities that is joining us today, this is a really like blank canvas for you to tell us from your perspective what needs to be done to help the population experiencing homelessness in your city. So again, I do want to take a minute to just let you think that through and add any comments that you have in this section. As Lauren had mentioned earlier, it is our intent to include the voices from all aspects of our community to help inform potential funding and ensure that this is an inclusive and diverse collection of responses. Please share with us if you identify with any of the key roles that's listed on this part of the survey. We are very intentional to lift up the voices of people with lived experience, youth with lived experience, and people who are from populations that are overrepresented in the homelessness system, which is generally people who are African American or Black, transition age youth, senior citizens, LGBTQIA+, single males, and people fleeing domestic violence. That is very important that we hear from folks who identify as any of these categories, because again, we want to make sure that we're really diversifying the voices that we're hearing, especially hearing from people who are impacted the most. If you work for a local jurisdiction, if you're a leader of a local jurisdiction, public agency, or education system, also impacted entities, local homeless service providers, the managed care plan, street medicine providers, community advocates, and concerned citizens. And you're able to click as many identities as you feel is appropriate for yourself. Thank you so much for that. And now I'm going to pause to see if there's any questions. Actually.